6 isometric postures that Japanese adults do every day, and you should too. While in many countries we see older adults losing strength and energy after 60, something extraordinary happens in Japan. People in their 70s, 80s, and even 90s walk with upright posture, squat with ease, take care of their homes, and many still actively work in the fields. And no, it's not privileged genetics or luck. Japan is home to one of the longest living populations on the planet, with an impressive number of octogenarians in full physical activity. According to the World Health Organization, the proportion of physically active elderly Japanese significantly exceeds the global average. The secret? Not expensive treatments or miracle medications. They are simple, natural movements integrated into daily life. So today you'll see 6 isometric postures that the Japanese practice regularly and that you should also incorporate into your routine. They can cure years of neglect of your own body. But before we begin, tell me in the comments how long you've been practicing physical exercises. Isometric posture number 1. Seiza. Seiza, which consists of sitting on your heels, is probably the most recognizable Japanese posture. With roots dating back to the Muromachi period, this position became a fundamental element of Japanese etiquette. Historically, Seiza was practiced in traditional houses with tatami floors, during tea ceremonies, formal meals, and moments of meditation. This posture intensely activates various muscle groups. Your quadriceps are deeply stretched, while the calf and ankle muscles are strengthened. The correct Seiza position also engages the deep abdominal muscles and spine stabilizers, significantly improving your overall posture. The benefits of Seiza go far beyond muscle strengthening. This position improves circulation in the lower limbs when practiced regularly, increases flexibility in the knees and ankles, and promotes better alignment of the spine. Recent research demonstrates that Seiza activates the connective tissues of the lower limbs, contributing to better tissue health and preventing problems such as plantar fasciitis. To properly execute Seiza, kneel on the floor with your knees together. Fold your feet so that the tops of your feet are resting on the floor, with your toes pointing backward. Lower your hips slowly until you're sitting on your heels. Keep your spine straight, shoulders relaxed, and hands resting gently on your thighs or knees. A common mistake is forcing the knees beyond their comfort limit, causing unnecessary pain. If you're a beginner, don't try to stay in the position for long periods immediately. Another frequent misconception is curving your back, which nullifies many of the postural benefits of the exercise and can overload the lower back. For beginners, I recommend starting with short periods of 30 seconds to 1 minute, interspersed with breaks to stretch your legs. As you develop more comfort and strength, gradually increase to 3 to 5 minutes per session. If you feel intense discomfort in your knees, a useful adaptation is to place a small, firm cushion between your heels and hips, reducing pressure on the joints. Over time, you can reduce the thickness of the cushion until you can perform traditional Seiza. Number 2. Neko-ashi-dachi. Neko-ashi-dachi, also known as the cat paw stance, is an elegant and functional position originating from traditional karate. Its name derives from the similarity to the posture of a cat about to jump, light on the feet, alert, and ready for explosive movement. Developed by martial arts masters during the Edo period, this posture was valued for allowing quick transitions between defense and attack. This posture intensely works the stabilizing muscles of the ankle and foot, strengthening an area often neglected in conventional training. The calf muscles, mainly the soleus, are activated in the foot that supports most of the weight. The position also engages the hip muscles, the lateral stabilizers of the leg, and the core, creating a complete kinetic chain of strengthening. The benefits of Neko-ashi-dachi are particularly relevant to modern life. Like Kibadachi, this posture significantly improves balance and proprioception, reducing the risk of sprains and falls. Research in biomechanics shows that this position strengthens the intrinsic muscles of the feet, helping to prevent problems such as flat feet and plantar fasciitis. Regular practice also develops neuromuscular coordination, essential for maintaining mobility in old age. To execute Neko-ashi-dachi correctly, position yourself with one foot forward, supporting only the ball of the foot on the floor, like a cat testing a surface with its paw. The back foot is fully supported, bearing approximately 70% of your body weight. Slightly bend both knees and maintain an upright posture. Your hips should be aligned forward, not rotated, and your abdomen gently contracted. A common mistake when practicing this posture is distributing the weight equally between both feet, which diminishes its specific benefits. Another frequent misconception is rotating the hip excessively, compromising alignment and overloading the lumbar spine. Many beginners also tend to raise their shoulders in tension, which should be avoided. For beginners, I recommend maintaining the position for 20 to 30 seconds on each side, alternating legs and performing 3 sets. As you develop more balance and strength, increase to 1 minute per side. Practice daily for the best results. Japanese masters often incorporate small weight transfers between the front and back of the foot, simulating the feline behavior that inspired the posture. An interesting adaptation to intensify the exercise is to add slow arm movements while maintaining the stable position of the legs. This variation increases the challenge for balance and engages the core even more, transforming a static posture into a dynamic exercise of body control. Before we continue, don't forget to subscribe to the channel. Having constant access to correct and science-based information is what will make you progress with health in the long term in the world of bodybuilding. Number 3. Zazen. Zazen, literally sitting meditation, is an ancestral practice of Japanese Zen Buddhism that transcends simple meditation to become a powerful isometric posture. Originating from Zen monasteries during the Kamakura period, this position was maintained by monks during hours of daily meditation, simultaneously developing mental and physical strength. This posture deeply engages the stabilizing muscles of the spine, particularly the multifidus and transverse muscles. The core is activated to maintain the upright position, while the pelvic floor muscles are naturally strengthened. In the legs, Zazen promotes intense stretching of the quadriceps, hip flexors, and adductors, while strengthening the deep postural muscles. Beyond improving posture and reducing back pain, recent neuroscience studies demonstrate that the position, combined with conscious breathing, activates the parasympathetic nervous system, reducing cortisol, the stress hormone, and promoting cellular regeneration. Regular practice improves hip flexibility and strengthens the deep musculature of the spine, essential for preventing common lumbar problems in the elderly. To execute Zazen correctly, sit on the floor with your legs crossed, ideally in the lotus position, which consists of each foot being placed on the opposite thigh. If this position is challenging, simply sitting with legs crossed already brings benefits. The spine should be perfectly straight, as if an invisible thread pulled the top of the head upward. The shoulders remain relaxed and open, the chin slightly tucked, and the hands rest in the lap, usually with the palms up and the fingers of the right hand on the left palm. A frequent error is curving the spine during practice, which not only reduces the physical benefits, but also compromises the meditative aspect. Another common misconception is excessively tensing the shoulders and neck, creating unnecessary discomfort. Many beginners also force their legs into painful positions, when the ideal is to progress gradually in flexibility. For beginners, I recommend short sessions of 5 to 10 minutes, using a firm cushion under the hips to slightly elevate the pelvis and facilitate spine alignment. As you develop comfort in the position, try gradually increasing to 20 minutes daily. Japanese Zen monks practice Zazen for several hours daily, divided into 40-minute sessions interspersed with meditative walking. Number 4. Shikodachi. Shikodachi, known as the sumo stance, has its roots in the ancient Japanese national sport, practiced for more than 1,500 years. This posture was, and still is, fundamental in the training of sumo wrestlers, developing the extraordinary leg strength and stability that characterize these athletes. Historically, wrestlers maintained this position for hours, developing the resistance necessary for ritualized confrontations in the sumo ring. This posture intensely works the quadriceps, glutes, and adductors, the inner thighs. The muscles of the lower back, deep abdominals, and pelvic floor are strengthened to maintain stability during the position. Interestingly, biomechanical studies reveal that this posture activates more muscle fibers in the legs than conventional squats. The benefits of Shikodachi are extraordinary, especially for healthy aging. The position develops exceptional functional strength in the legs, essential for daily activities such as lifting, sitting, and climbing stairs. The opening of the hip promotes greater joint mobility, preventing common problems such as osteoarthritis. The pelvic stability developed in this posture significantly improves balance, reducing the risk of falls in the elderly. To execute Shikodachi correctly, spread your legs wide, approximately twice shoulder width, with your feet pointing outward at a 45-degree angle. Deeply bend the knees, lowering the hips as if sitting between the legs. Keep your back straight, chest open, and gaze forward. The hands can rest on the thighs or be positioned in front of the body, as if holding an imaginary opponent. A common error is arching the lower back, which transfers tension to the back instead of properly working the legs. Another frequent misconception is not lowering the hips enough, reducing the effectiveness of the exercise. Many beginners also tend to let the knees collapse inward, which can overload these joints. For beginners, I recommend maintaining the position for 20 to 30 seconds, performing 3 sets with a rest interval. As you develop strength, gradually increase to 1 to 2 minutes per set. Professional sumo wrestlers can maintain this posture for impressive times, some reaching 15 to 20 minutes uninterrupted during special training sessions. Number 5. Kibadachi. Kibadachi, known as the horse stance, has ancient origins in Japanese martial arts, particularly in karate. This position was used by samurai during training to strengthen the legs and core, preparing them for long battles where stability was crucial. The name horse comes from the similarity to the posture adopted when riding a horse. This isometric posture is extremely effective for working the leg muscles, especially the quadriceps, adductors, and abductors of the thigh. Kibadachi also intensely engages the glutes, hip stabilizers, and core. Beyond muscle strengthening, Kibadachi significantly improves the lateral stability of the body, something we often neglect in conventional exercises. Biomechanical studies show that this posture develops balance and proprioception, which is related to how you perceive your body in space, reducing the risk of falls in the elderly. The position also promotes better alignment of the hip and knees, preventing common joint problems. To execute Kibadachi correctly, position your feet parallel and apart, approximately at the width of 4.5 feet. Bend your knees and lower your hips, as if sitting in an invisible chair. The feet should be pointing forward, fully supported on the floor. Keep your back straight, abdomen contracted, and arms relaxed at your sides or extended forward. A frequent error is tilting the trunk forward or excessively arching the back. This transfers tension to the lumbar region, reducing the work of the legs and potentially causing injuries. Another common misconception is raising the heels from the floor, which compromises stability and reduces the benefits of the exercise. For beginners, I recommend maintaining the position for 20 to 30 seconds, performing 3 sets with a rest interval. As your resistance increases, extend the time to 1 to 2 minutes per set. Japanese martial arts masters often maintain this posture for 5 minutes or more, developing extraordinary strength in the legs. An interesting variation of Kibadachi is to add small lateral movements, transferring the weight from one leg to another without changing the height of the hips. This adaptation makes the exercise more dynamic and works even more the stabilizing musculature. Number 6. Wall squat. The wall squat, although not originally Japanese like the previous postures, has gained extraordinary popularity in modern Japanese gyms since the 1980s. This isometry represents the perfect fusion between the ancient Japanese wisdom about sustained postures and the discoveries of contemporary sports science. In Japan, this technique is frequently incorporated into katsu training, basically a training with blood flow restriction, developed by Japanese scientist Dr. Yoshiaki Sato. This posture intensely works the quadriceps and also significantly engages the glutes, hamstrings, and core muscles. Unlike dynamic squats, the isometric version against the wall maintains constant tension, promoting greater muscle endurance and recruitment of slow-twitch fibers, fundamental for postural health. The benefits of the wall squat are extensive and well-documented scientifically. Recent studies demonstrate that this posture improves knee joint stability, reducing the risk of common injuries such as anterior cruciate ligament ruptures, which I myself have suffered in my life, and I confess that I do not recommend it to anyone as you will go through long and painful months of physical therapy. Prolonged isometry also stimulates muscle capillarization, improving blood circulation in the legs. Research indicates that regular practice of this exercise contributes to the maintenance of bone density, crucial in preventing osteoporosis. To execute the wall squat correctly, position yourself with your back against a flat wall. Move your feet approximately 12 inches from the wall and at shoulder width. Slide your back down the wall, bending your knees until forming a 90-degree angle, as if sitting in an invisible chair. The knees should be aligned with the ankles, not exceeding the line of the toes. Keep the abdomen slightly contracted and shoulders relaxed. A common mistake is allowing the knees to collapse inward, which can cause injuries and reduces the effectiveness of the exercise. Another frequent misconception is keeping the hips too high, diminishing the work of the quadriceps. Being an isometric movement, many practitioners also make the mistake of holding their breath during the exercise, when the ideal is to maintain controlled and constant breathing. For beginners, I recommend maintaining the position for 30 seconds, performing 3 sets with adequate rest interval. As you develop endurance, progressively increase to 1 to 3 minutes per set. In Japanese gyms, it is not uncommon to see advanced practitioners maintaining this position for 5 minutes or more, often accompanied by specific breathing exercises to enhance the results. An interesting adaptation, popularized by Japanese trainers, is to add a soft ball or small pillow between the knees, pressing it slightly during the exercise. This variation more intensely activates the adductors of the thigh and promotes better alignment of the knees, transforming an already effective exercise into an even more complete version. Interestingly, in addition to the muscular benefits, studies conducted at Japanese universities demonstrate that regular practice of wall squats can improve cardiovascular function similar to moderate walking, making it a valuable option for people with reduced mobility or on days with unfavorable weather for outdoor activities. If you liked this and also want to discover 10 mistakes that most people make in training that unfortunately throw all effort in the trash, we have a video appearing right now on the screen showing each one better. Don't miss it. Thank you for watching until here, and God bless you, my friend.